The global stage.
Hi, this is the global stage. Jesus Christ is the same yesterday, today, and forever. In today's lesson, we will discuss sickle cell disease, and our focus will be on sickle cell anemia. We will learn some management, treatment, and preventive ways to deal with this condition. What is sickle cell disease? It is a group of uninherited blood disorders marked by defective hemoglobin causing the red blood cells to be sickle-shaped. The common types include HBSS, HBSC, HBS-beta, thalassemia, HBSD, HBSE, and HBSO. But the most common one and severe type is the autosomal recessive disease, HBSS, called sickle cell anemia. And this will be our focus in this video. The lesser common one is the autosomal dominant disease, HBAS, which is called sickle cell trait or carrier. What is a hemoglobin? A hemoglobin is a protein in the red blood cell that allows the red blood cells to carry oxygen to all parts of the human body. And the adult hemoglobin is composed of 4 protein chains, 2 alpha and 2 beta chains. A mutation in these 2 beta chains are what is responsible for the types of sickle cell diseases. Remember, our focus is on sickle cell anemia, HBSS. The normal hemoglobin is called hemoglobin A, and it is round, smooth, and concave in shape and do not have a nucleus. This allows the RBC or the red blood cells to easily squeeze through your vessels, that is your veins, your arteries, and your capillaries, to carry oxygen smoothly to all the organs and tissues of the human body. The normal hemoglobin has a lifespan of about 120 days, while the abnormal hemoglobin S has a lifespan of about 20 days. People with sickle cell anemia inherit each mutated gene from the parents. The result is that all children born from them will have the disease. Also, people with sickle cell anemia have hemoglobin S, which causes the red blood cells to be stiff and stick to the walls of the blood vessels, causing circulation problems. Now let's look at the signs and symptoms of those with sickle cell anemia. The first sign or symptom of those with sickle cell anemia is pallor or yellowish discoloration of the eyes and the skin. Because the red blood cells are abnormal, they don't last longer like the red blood cells, and they tend to break down and rupture in about 20 days, leading to anemia. Also, there is a vaso-occlusive symptom which leads to periodic painful episodes called pain crisis. There is swelling in the hands, in the feet, and the joints, a condition called dactylitis. Because the sickle cells are rigid and sticky, they cause clamps, and this eventually stick to the walls of the vessels, causing obstructions in these small vessels, reducing oxygen supply to the tissues and organs of the body, causing acidosis and infarction. And this can result in the blindness of the eyes, pulmonary hypertension, renal failure, and even strokes. Also, there is shortness of breath, fatigue, and delayed growth due to anemia, because the red blood cells are breaking down quickly and the bone marrow can't keep up with the production of red blood cells. Eventually, they get weakened, and this leads to aplastic anemia. Lastly, there is the enlargement of the spleen. The spleen is the chamber for dead red blood cells and also recycling, and also aids in fighting infection. But the fast destruction of the red blood cells can overwhelm the spleen, and eventually they cannot be able to keep up, and this will lead to enlargement of the spleen, and then also increases one's chances of getting infection. So these are the signs and symptoms of those with sickle cell anemia. Now let's look at the triggers of the pain crisis, because the pain crisis is the most common symptom one can have with sickle cell anemia. The abnormal hemoglobin S is very sensitive to low oxygen in the body, and so anything that causes the body to increase its demand for oxygen will trigger the episodes, that is the pain crisis, and this will cause the red blood cells to change its shape and they become sticky, stiff, and that is what we don't want. So you need to avoid these triggers. They are: number 1, dehydration; number 2, higher altitudes; number 3, infections; number 4, cold weathers; number 5, extreme exercise; and number 6, extreme stress or stress itself. It is also important to notice that persons with a trait such as HbAs or HbSc can also experience the pain crisis when exposed to the extreme conditions of the triggers I just mentioned to you. Otherwise, there will be no health problems. Let's look at how we can diagnose somebody with sickle cell anemia aside the signs and symptoms. And basically there are 4 ways. Number 1 is sickle dex. Number 2 is newborn blood spot screening. Number 3 is blood smear. And number 4 is protein electrophoresis. How can we manage this condition? The focus is to improve and achieve good blood circulation and increase blood production, and also manage the pain. There are basically 7 ways. Number 1 is hydration. Hydration will help dilute the blood to alleviate the stiffness and help the kidneys function well, and also increase oxygen concentration. Number 2 is by blood transfusion. This will increase the amount of red blood cells and treat the anemia. Folic acid can also be given to help with the production of red blood cells. And a lot of times we don't give iron because it may cause iron toxicity. Number 3 is prophylactic antibiotics and opioids. The drug called hydroxyurea helps promote the formation of fetal hemoglobin F, which helps in carrying oxygen to the tissues of the human body. Number 4 is another complicated procedure called bone marrow transplant. Number 5 is by warm compressions. You loosen all tight areas. You elevate the extremities to increase blood flow to these extremities. Number 6, don't overexercise. Prevent infection. Avoid high altitudes. Avoid cold areas or weathers, and avoid stress. Lastly is another complicated procedure called stem cell transplant. Having said that, let's look at the genotype cross-matching table and the possibilities of the sickle cell anemia in children born to parents with this trait or the disease, and who you are compatible with when it comes to the decision of marriage. In this table, T stands for the trait, N stands for normal, and SC stands for sickle cell. So assuming that the father has the trait and the mother is normal, there is 50% chance that your children will inherit the trait from the father, and another 50% chance that your children will inherit normal from the mother. Also, assuming that both parents, that is the mother and the father, have the trait, there is a 50% chance that your children will have the trait, and 25% chance that one of your children will be sickle cell anemia, and another 25% chance that your children will be normal. Again, if both parents have the sickle cell disease, that is SE, then there's 100% chance that all your children will have the sickle cell anemia. So who can you marry and who can you not marry? If you look at this table, the genotype is AA and AA. So there is 100% compatibility that all your children will be AA, that is, they will be normal. Therefore, you can go ahead and marry. If one of your parents is AA and the other is AS, there is 75% chance that your children will be normal. You can also go ahead and get married. Then again, if one parent is normal, that is AA, and another has the sickle cell anemia, there is 50% chance that one of your children or all of your children will either be AA, AS, or have the sickle cell anemia, SS, and so you can still go ahead and marry if you want to. But if your parents or both of them has the trait that is AS, then there is only 25% chance that your children or your child will be normal. Therefore, there will be 75% chance that your child will be AS or SS, and therefore we do not recommend that you go ahead and get married. Lastly, if your parents or one of them is AS, that is, he has the trait, and another is SS, that is, has the sickle cell anemia, there is 0% chance that your children will be normal, and therefore we do not recommend that you go ahead and get married. So this brings us to the end of our topic, sickle cell anemia. Don't forget to like, comment, and share. If you have any questions, you can also send me the questions under the comment section, and I'll be glad to answer you. God bless you.